Help me grow, fast or slow, as long as I know you're digging for gold. Help me learn, soft or stern, as long as I know you're digging for gold. Life's a movie, the ultimate trip. You should have been told you'd be digging for gold. Hello, my friends. Once again, as you know, I'm Dan Goldberg. This is episode 35 of Digging for Gold. And don't forget, subscribe and follow. You can do that by going to dangoldberg.com, going to the front page, the first page of the website, and clicking on all those icons for YouTube, for Spotify, for TikTok, for Instagram, and all the other ones. A very interesting, special friend today, okay? Another one of those guys that I've known since I was an embryo, Ron Goren, Dr. Ron Goren, physician Ron Goren, who specializes in infectious diseases, right? And I don't know if you remember there was a thing called COVID. It was a pandemic. Wow. So we're going to touch on that, but Ron also is going to discuss vaccines as well. Welcome, Ron.
Thank you. Thanks for having me.
Thanks for being here.
Yeah, I know. It's my pleasure. Anytime I can talk about vaccines and COVID, it's fun.
Yeah, and super flu.
Yeah, that's right.
Super flu.
Yeah.
So tell us about vaccines a bit.
Well, I'll give you a little about myself.
Yeah.
All right. I've been doing...
Wait, let me ask you.
Yeah, sure.
Have you been vaccinated?
Absolutely.
All right. Okay, continue.
I am up to date.
Continue.
As are all my kids and all my grandkids. Thank you very much.
Perfect. So as you were saying.
All right. So as I was saying, I've been doing infectious diseases for almost 50 years. I am at the same age as your host, and we've been, and I've been, it's a great subspecialty. You don't get rich, but it's a wonderful field because it's always something happening in infectious diseases.
Correct.
I lived through AIDS. I lived through COVID. I lived through the epidemic of flu 9 years ago and other things like that.
Right.
And whenever there's something hot, the hospitals sometimes call me to go on one of the local stations. They interview me for 20 minutes and take the two stupidest thing I say and put it on the air.
Right. We don't do that.
No, I know. I'm quite. And 7 years ago, after working 10 hours a day and every third or fourth weekend, depending, I decided I wanted to get home for the evening news, and I gave up practice. The practice that I started in 1979.
Wow.
Was up to 11 people at that point, going to all the hospitals in Northeast Philly and Lower Bucks County doing consulting work for the other physicians on infectious diseases. Mm-hmm. And now what I do is largely administrative and teaching. I teach the medical residents at the two hospitals I'm at, Nazareth Hospital in Philly and St. Mary's Hospital in Bucks County. And I also do what we call antibiotic stewardship. I'm trying to educate the doctors and make sure they know the right way to use antibiotics because we're starting to experience a lot of resistance. Mm-hmm. And I'm trying to get them to cut back as much as they can and not just put everybody on antibiotics. I always used to say to them, listen, if somebody would ask me, what should I take for this condition? I would say, should I take azithromycin? I said, yeah, you take azithromycin, you'll be better in a week. If you don't take it, it's going to take 7 days. So I mean, that's my job right now, and I work on infection prevention at the hospitals and try to keep the infections in the hospital down. And it's been I had a great career, and it's been great doing what I do now because I wasn't ready to give up using my brain in infectious diseases, but I just really needed to get my life back. I don't always watch the 6 o'clock news, but damn it, I'm home for it. In fact, I try not to watch the news now.
Yeah.
That's another story for another day. Okay.
All right.
Okay. And as with everything that's going on, I'm very passionate about certain things. If you want me to just launch and do my thing,
launch.
all right.
Absolutely.
So what I'd like to do, just a little preamble to get you into what's going on in the world today. This is not political. This is all medicine. What they're doing in HHS, Health and Human Services now, is horrible. And it's caused so much, and there's other reasons for it too, COVID. We can talk about that as well. But they have completely messed up the vaccine schedule that has been good and true for years, and isolated a lot of very smart people, fired a lot of very smart people who knew what they were talking about, and brought in a lot of people who are very anti-vax. And the problem is with vaccines is that it's sort of paradoxical. When a vaccine works, nothing happens.
Right.
People live their lives. The kids don't get sick. They grow up. Everything's great until somebody comes along and says, you know that thing that you stuck your kid with? It's going to kill them and make them autistic. All right. And the problem is that, as I said, people don't remember what it was like before we had vaccines. Your host and I grew up at a time when we got all these vaccines. When polio vaccine came out, my father was a young pediatrician. He couldn't wait to get us vaccinated.
Yeah,
polio was
yeah.
a devastating disease back then.
It's true.
Thousands and thousands of kids got paralyzed with polio.
Yeah.
Measles, they talk about the measles vaccine.
Measles is taking off again in the
Yeah,
Carolinas,
well, in this country, I'll mention, but back in the day, it was 50,000 cases, 7,000 cases a year.
57,000
a year, measles in this case.
I had it.
Three per thousand deaths, but 240 hospitalizations, and a lot of kids were hospitalized with diarrhea and pneumonia.
240,000?
240 hospitalizations.
Oh, okay.
Probably per thousand.
Yeah,
when you
yeah,
have
yeah.
57,000, it's per thousand. I should have said that. And it was a really devastating disease. And measles is incredibly contagious. Right now in South Carolina, there are over 600 cases of measles. And measles is so contagious that if you're in a large room with no walls, and a measles person walks in, they will infect 12 people around them, even if they're at the other end of the room, because it's all airborne virus.
Wow.
And in order to have what they call herd immunity, to shut down an epidemic like we did in the early 2000s in this country, we basically eradicated measles, except for people coming in from foreign countries. You need 97% of the population immune or vaccinated. And we did that in 2000. And now we have ongoing measles throughout the United States. Kids are going to the hospital. Fortunately, we've only had 3 deaths, the 2 young ladies in Texas and an older fella in New Mexico, I think, who wasn't vaccinated either. And all those cases in South Carolina were kids who weren't vaccinated.
Wow.
I can go through all the diseases: rubella, German measles, 20,000 babies with birth defects, either cardiac or blindness and deafness, very common. And I could go through all of them, chicken pox, and we're even seeing people now in the country with tetanus. Who gets tetanus in the 21st century? But people aren't getting vaccinated anymore.
Tetanus.
And whooping cough, same thing. We've had 33 deaths of whooping cough in this country, which is pretty much unheard of. These are all infants, and they're not vaccinated. And the moms aren't vaccinated. Yeah, go ahead.
They got 33 cases of whooping cough where people died?
Where infants died of whooping cough because they weren't vaccinated. If they were older, and mom, if they get vaccinated, can have antibody that protects the baby for 6 months.
It's interesting because when I went to see my great grandson, and I went to see my grandson, through marriage, both of them asked me to get that vaccine before I saw the baby.
Babies. Yeah, my kids told me that too.
Yeah, get the thing. So I got the thing. You don't even feel it. It's like nothing.
It's like nothing.
Yeah.
And the problem is, as I said, people don't remember, and we've got a long history of anti-vaxxers, and they really fall into 2 groups. You get the group that just doesn't know anymore because they've heard all this false information and they're afraid to vaccinate their children. They don't understand, and you can reason with them. And then there's the cultists who just will not listen to anything you say. It's like trying to argue evolution to a holy roller. I mean, it just doesn't work for those people. And the problem, vaccines are incredibly safe. Incredibly safe. Nothing is perfect. Nothing we do in medicine may have some problems associated with it, But the process in the United States was to do this over periods of time and watch patients. And if something changed, they would jump in and do it. And they've improved the vaccines as we've gotten older. Wow. They've lessened the extra antigens being the substance that your body uses to make the antibody to fight the infection. The other thing about measles that nobody tells you, I'm going to bring that up too, it's called the long shadow of measles. Measles has a long incubation period, and when it gets into your body, it goes to your spleen and other lymph nodes, and it eradicates a lot of the immune cells that have already been exposed to infection. So a young child who gets measles, who's had a bunch of mild infections over the past, or maybe not so mild, now has lost that immunity, and for the next, can go as long as a couple of years, there's an increased risk of them getting other infections and having more hospitalizations as a result of those other infections. So nobody tells people this.
Right.
And
except now.
Except now,
right
absolutely.
Here on Digging
And
for Gold.
the vaccines are, as I said, they're very safe. You know, the whole thing started with a guy named Wakefield, Andrew Wakefield, a British gastroenterologist, a GI doctor,
right,
who published 8 cases where he assumed that based on something he found that the measles vaccine causes autism. And they published that in Lancet, a very prestigious British medical journal. Within days of going on, there must have been 500 letters say that study's stupid, it's wrong, and there's no reason to put that up. But nobody, none of the press picked that part up.
Right.
And there always have been some low-grade anti-vaxxing, but after that, he comes. Now he lives in his country in Texas, of course,
right,
and now he spreads it around. During the big outbreak of measles for Hasidic Jews in New York City in the mid-teens, he talked to him online and said, "Don't listen to these people. It's bad for you. Your kids will all be autistic." And they've done many studies now to clearly show that MMR vaccine and other vaccines do not cause autism. There has nothing to do with it. So what did the anti-vaxxers do? Oh, it's due to that thimerosal, what we used to call merthiolate, ethyl mercury in the vaccine.
I dated her, by the way.
Yeah, that's right.
I dated her, and I dated a woman named Vaccine, or I thought her name was Vaccine. It was a bad connection. Her name was actually Maxine, but I thought it was Vaccine.
Well, that's all right. She was ahead of her time. That's all. There's no problem.
True. That's true.
Where was I? I was. That's
it.
That's it. Where was I?
So this guy.
So that took off. Now, fortunately, everybody got vaccinated in the 90s because there was a big outbreak in the late 90s, early 80s of measles, and it eradicated in 2000. And in 2009, he lost his license in Britain, and it was also found out he was taking money from the wrong people to publish his study. Not a big surprise.
He lost his license?
Yeah,
Did he
lost
look in
his
the
license.
backseat of his car?
I don't know where. He's living somewhere in Texas. I don't know. That's what I heard anyway. And so that feeds on itself. And then you have Robert F. Kennedy Jr., who takes money from these anti-vaxxer groups that are out there, and now he's the head of Health and Human Services. And we got rid of thimerosal. The next thing was aluminum. They said, oh, there's too much aluminum in the vaccines, and they've been using aluminum vaccines since the 20s for different things. And there's so little aluminum apparently is very prevalent throughout it's in the water, it's in the food, it's everywhere. You get much less in our vaccines than you get in, and that's been proven by doing blood studies and stuff, you do just drinking water.
They always make aluminum the foil.
Yeah, that's it. Oh, Danny.
I'm sorry, Ronnie. I can't help myself.
That was good. That was very good.
Funny.
Yeah, don't cut that out. That was good.
No, you leave it in. I think I have a bunch in my blood, though, from drilling out the transmission case for a bracket.
That could happen, yeah. And then they said, oh, no, we're giving too many at once. And I won't say it. They're giving too many vaccines at once, and we should spread them out. Well, they did that in Japan. It didn't have any difference, and it makes no difference functionally. And apparently, even for the kids, the first one is the one they're most scared of. After that, it doesn't make nothing. And they've actually looked at this.
By the way, when I was in the service, right?
Yep.
I was in Fort Leonard Wood, and I'm getting ready to do my basic training.
Like Stripes.
Like Stripes. One of my favorite movies, by the way.
Yes, right.
And the producer's name was Dan Goldberg.
Oh, there you go.
Yeah, see?
Yeah.
And
I love
They
that.
take out this gun, right? They call it a gun, and you get all these vaccines
that's
at
right,
once.
that's right.
You just hit you right here, and
Yeah.
that's it. And then you walk, unless the guy faints in front of you,
Right.
which does happen. But
And
it's
people
like
say,
nothing.
"Oh my God, my arm hurt, and I was sick for 2." But that's just your immune system
Yeah.
processing the vaccine. That's a
bother
good
me.
thing in a funny sort of way.
And they don't let you get that sick in
Yeah.
the Army. They
Yeah.
say, it's too bad. You got to get up
Get up in the morning
at
and
6 o'clock.
and
5
peel those
o'clock.
potatoes. I know.
Right,
Yeah, it's
exactly.
great. And so my purpose now in life is to educate people about infectious diseases and educate people about vaccines, and hope that people realize that what they're hearing is wrong. I don't want this country to go back to the 19th century where kids are dying. Yes, we've eradicated polio in 1980.
Yeah.
It was gone in this country, but in other parts of the world, they have it. If they
Yes.
don't get polio vaccine, it's going to come back.
Right.
And the last
Sure,
guy,
there's
the
so-
last iron lung, died in the spring. He just died.
Where? What country?
In this country, he was in an iron lung for all his life, and guy
Wow.
was smiling at the end. I don't know. It's kind of goofy, but anyway. So ask questions. I'll be happy to talk about it. I can go into more detail on anything you want me to go into detail about.
It's very interesting to me. I will bring this up. I got every possible COVID vaccine, and I still got COVID twice.
All right. I'm glad you asked that question. There's two kinds of infectious diseases. One has a long incubation period, like measles.
Right.
And there's most of our respiratory viruses, like flu and COVID, have a short incubation period, just a couple of days.
Mm-hmm.
If you have a long incubation period and you've been vaccinated, what happens with many vaccines is, after a while, the first thing it does is make gamma globulin in your blood that's aimed at the COVID. Well, COVID does a couple of things. One, it mutates all the time, right? You always hear
Right.
about a new thing that's out. And the other one is that as it goes down, you can still get it again. But you have two arms of your immune system. You have the antibody arm, and you have what they call the T cell arm, the cell-mediated arm. That generates memory cells. When you have a long incubation period, you have time for those memory cells to come out and keep it from doing harm. When you have a short incubation period like COVID, especially if it's changed a little bit, you can get sick again. But you don't go in the hospital, you don't go on a ventilator.
true.
It keeps you from getting sick. That's the same with the flu vaccine. The flu vaccine is the same way. Yes, people get flu. It's not a perfect vaccine. They're working on a better vaccine for the flu that you don't have to get every year. But if you get it, it keeps you from getting sick and going in the hospital. There's good data to support that. At children, we lost 200 and some children to flu last year. That's unheard of in this country
Whoa.
because they're not getting vaccinated. And
Excuse me, I'm still getting over that thing that I had a month ago.
well, I mean, I've had COVID twice, and the first time I was sick for a couple of days, and then it was gone. And over the summer, I had it, and it was like nothing.
Yeah, I had the first time I had it, it was nothing.
Right.
I couldn't even tell unless I took the test.
Yeah.
The second time it was a little more, evident.
But you didn't need to go in the hospital.
No, I
you
didn't
didn't
need
need
to
to
go
take
to-
medicine, and
No.
we're of the young and tender age group that you can
Right.
get sicker with these things.
Yeah, so that memory vaccine,
Right.
Can I get that? Because, it'll help my memory. What time is it and who am I?
Unfortunately,
Okay.
it's not the right kind of memory. The immune
course.
system is pretty impressive. I got to tell you,
It
it's
is pretty
really
impressive,
it
yeah.
really is an amazing evolutionary development in animals and people, and you can. That's what we depend on. Not only the antibody, but the secondary T cell-mediated immunity, which can generate cells to fight the virus in cells and make more antibody if you give it enough time to do it. And if you don't, then the disease is already running its course and it's too late. But it keeps you from getting sick.
It's interesting, Ron, the way you explain it. And I wonder why, and you probably have an answer for this, we haven't figured out a vaccine for different kinds of cancers.
I really, that I don't have an answer for that. There are some of the newer anti-cancer medicines. The first generation, I'm blocking the name, but they actually make your cancer cell more able to get recognized by the immune system. Because another thing our immune system does is it knocks off abnormal cancer cells. When they change, it recognizes them as different and it knocks them off. But something changes, certain people are born with certain genes that have a higher propensity of getting cancer, and then we magnify that by smoking and drinking too much and eating too much meat or whatever the heck it is that it is, and it accelerates that. And some poor people, the majority of, as I understand it, childhood cancers come because they have a really bad gene that clicks off by itself even without having a problem. My father was a pediatrician, and my first rotation in pediatrics was at St. Christopher's Hospital in the oncology ward. Now, this is the 70s, before they had any. Right. I couldn't become a pediatrician. I mean, I can see, an adult gets sick, you beat your wife, you didn't pay your taxes, it's karma. But a little baby, you're trying to stick a needle, take a knife, I couldn't do it. And my dad said, that's not what I do. It's in the office. I take care of healthy kids. I said, yeah, I know, but it's...
Yeah, but St. Chris's or CHOP or something, you see these little kids.
You see these little kids,
even on,
tough.
St. Jude, when I see the ads for St. Jude. It's tugs at your heart. And
one of the ways in California, there was a whole group of sort of yuppies that were really anti-vaccine. They didn't want it. They didn't want the state telling them to get vaccine. They made their own schools, and they would pay people. They pay doctors
to not vaccinate them?
To give them a medical exemption to vaccinate it.
Oh, God.
And they tried to pass this law, and they couldn't get it passed right away. And at one of the meetings, a little boy got up and said, I have leukemia. I said, and I can't get vaccinated. I need everybody else to get vaccinated to protect me. Is there anything wrong with that? And that passed the bill in California, as I understand it. So that there are no more medical exemptions in California.
Wow.
I mean, if you have a religious exemption, and really there are no religious exemptions that I'm aware of. I mean, I think Jehovah's Witnesses or something, that may be, but there are none. I've dealt with, there's a group of Hasidics up in Bucks County, and once this one nurse refused to get a flu shot. And she said, I'm Jewish, I'm Hasidic, and my religion says I'm not allowed to get that. So I called the Rebbe. That's what he called it, the Rebbe.
Right, the Rebbe.
And I knew he was a young guy, but he still talked like he was 80 years old. Right. And
he said,
and
what?
He says,
what?
He said, well, he said, no, there are no medical exemptions, but the Talmud tells us, you could hear him doing this when he was talking. I'm raising my finger up in the air. The Talmud tells us that if you think something is hurting you, you don't have to do it. And she decided this would hurt her, and she didn't want to do it. I said, but she's going to have to wear a mask all winter in the hospital. He says, that's not my problem.
Wow.
So I mean, there are no real medical exemptions. Even I'll tell you another interesting story. The vaccine that they use to make polio. Mm-hmm. Polio is a virus, and it doesn't grow. I'm sorry, measles. Measles.
Okay.
Measles.
Do weasels get measles?
Weasels don't get measles, but
good.
Weasels can get the flu pretty bad.
They can?
Yes, they use them sometimes as guinea
they
pigs.
can.
They use measles as guinea pigs, which upsets the measles terribly. They don't want to be guinea pigs. Anyway, where was I?
Do animals get COVID at zoos too?
Yeah, they say dogs and stuff can get COVID. It hasn't been a real big problem apparently, but. Where was I going with?
We were saying about measles and weasels.
Measles and weasels. When you want to grow a virus, you have to do it in cells. Mm-hmm. And so, apropos of what we were talking about religion, the cells they used in the late 50s were from scheduled abortions, fetal tissue from scheduled abortions. Mm-hmm. And now that would be an anathema right now to do something like that. But they did it, and these cells have been growing in tissue culture for years and years. It has nothing to do with abortions anymore. Right. And the Catholic Church actually came out and said, we know the history. It's okay. If you need this vaccine, you get the vaccine. We're going to go with it.
Stem cell, right?
They were not stem cell. I don't know where they got the cells from. I'll be honest with you. I don't know where, but they were neonates, and they probably got them as stem cells. That may be what it was. But whatever it is, the measles virus grew very well in these cells, and they were able to use that to make the vaccine. And the guys won the Nobel Prize for doing that.
Wow. That's pretty
So
cool.
I mean, but the church said no problem. We no abortion. You know, let's you
Right,
have
but
sex
this is-
standing up if you don't have sex standing up if you're an Orthodox Jew because it's too much like dancing. Never mind.
I never thought about that. That's why she wouldn't dance with me.
There you go.
Now I realize
There
it.
you go.
Of
That was
course.
I didn't want to tell you the whole joke, but that
No,
was
yeah.
we could do it this way, we could do it that way. How about standing? No. Too much like dancing.
Too much like dancing. Really? And I said, this is a great song to dance to. And she said, absolutely
Really
not.
not. Yeah.
No.
Yeah.
Now I know. Thank you, Ron.
Yeah, it's my pleasure. That's what I'm here to do, educate people.
Educate. And I'm an educator.
That's
So I've been
right.
educated
Hey.
more than once
Yeah.
by you.
You got to keep learning. That's what
I
it's all
do.
about.
I'm
Here I am thinking about Henrietta Lack, and I think
Yeah,
that
the same, Henrietta Lacks,
But I think her family sued, right?
They did sue.
Eventually? Yeah.
Henrietta Lacks was
educate me on Henrietta Lacks.
Henrietta Lacks was an African American woman who, and the people at Johns Hopkins, she passed away, and they used, I forget what cell line they used, but they used her cells, and they made them in a certain way that they now have a business. They're called HeLa cells, Henrietta Lacks.
Wow.
And if you want to do viral work, you get HeLa cells, and you buy them. I don't know anything about the mechanics of it, but at some point, and they never asked her permission. They never asked the family's permission, and so the family sued, and they had a nice settlement out of the deal. Because,
Really?
Yeah, absolutely.
And you can still get her cells?
Yeah, absolutely. I mean, it's like it's 30 years,
fifth
40 years
generation.
later,
Right,
generations later, but.
Yeah, so the cells replicate.
Yeah, right. They replicate them, and then you can buy them and use them to culture and viruses.
Wow.
Because bacteria, you go in an agar plate, you streak
Yeah,
them and all that
yeah,
stuff.
yeah,
But viruses, you can't do that. They only live in cells. That's the way a virus works, right?
Wow. So, but they're living in my cell phone now?
Yeah, absolutely. That's why it always drops off, because they're messing around with the
It does.
electronics.
I said, why can't I get a connection in here?
Yeah,
It's a
that's
virus
it.
in
The
my
virus,
cell.
and you have viruses.
Of course.
Yeah, no. So it's and it's just for anybody who doesn't know, the two major things that we worry about for diseases are bacteria, obviously, and
Right.
viruses. Bacteria are little cells.
Mm-hmm.
They have the same metabolism we do. They grow by themselves. They have, and they're the ones that can cause, and they live in our gut, and that's good.
Yes.
The microbiome, and and viruses are just little packets of nucleic acid, DNA or RNA. That's all they are.
yeah.
And they get in the cell and they adopt the host's replication machinery and multiply. And HIV would go in and live in the nucleus and then come out and multiply, and that's why we can't get rid of HIV. So it mutates too much.
But we're not rid of HIV.
No, we're not.
But there are pharmaceuticals that mitigate it.
Yes, you can. There are pharmaceuticals that mitigate it, and there's no vaccine, and there's, of course, using common sense when you do things.
Right.
But yes, there are good medicines now,
Yes.
very good medicines. And I'll tell you. All right, you mind if I tell another story?
No, go
All
ahead.
right. So
That's why you're educating me.
I review charts. That's what I do with my colleague in pharmacy. These smart young ladies are really brilliant. And we had a case of a young man from Honduras who came in and had pneumonia in both lungs, and he was not getting enough oxygen, and they had this long differential diagnosis, all these esoteric things. And I lived through I was there with the AIDS epidemic. I saw a lot of patients with that AIDS-related pneumonia. They used to call it PCP.
Yeah.
And
As opposed to the PCP that people would take.
No, yeah, this is
different.
it's pneumocystis carinii. Now they changed it to PJP, but I refuse to recognize that. I took care of too many people with PCP.
Right.
But anyway, and they didn't even think about that. I mean, I wasn't a genius. I lived through that era. I took care of so many people with this. And I said, this kid's got PCP. Did anybody take a sexual history, which a doctor should really do if there's anything weird going on? Nobody took a sexual history. And when you have PCP, your immune system is really messed up. And very frequently, they have thrush, like a baby does, in the mouth. And I said to the resident, go look in the mouth. And sure enough, it had thrush. And I said, you got a diagnosis. You don't have to
What
do
is
anything else.
thrush?
Thrush is like a fungus. It's Candida, Candida albicans, and you see it in babies a lot. Diaper rash.
Oh yeah.
It's diaper rash, and so
Wow.
these kids don't see this anymore. Apropos of what you were just talking about, patient, you can live a normal life with HIV as long as you take your meds.
Sure.
And
So it's a fungus. There's a fungus among us.
It's a fungus among us. Yeah.
Wow.
It's a bad fungus, not a good fungus.
Yeah, that sucks.
The good fungus is cerevisiae, Candida cerevisiae makes beer. It's terrific.
That's true. Yes.
That's a good fungus.
That is a good fungus. So if somebody comes in with that, what do you do? Put a straw in their mouth?
That's right. That's all you have. Get some beer, and it's very
Right.
you do fine.
That's it. Yeah, Budweiser.
Budweiser. That's right.
That's it. Yes.
Yeah.
So now we're living in a time
Right.
where COVID is still there,
Yep.
but it's been, to use the term I just used earlier, mitigated.
Mitigate.
Okay, you don't.
Yeah. People
don't
don't get
see
as
them.
sick.
Right.
Yeah. If they.
But-
Yeah.
Yeah. No. Go ahead. If
No,
they
if they've been vaccinated and had it once or twice. If
Right.
you're a virgin, like a child is, you can get it. And despite what they say, really little kids can get sick with COVID. The other ones, early on, they got some weird syndrome, organ dysfunction syndrome, but now you don't see that as much. And the younger kids don't seem to get very sick.
Right.
It's 5, 6, 7, 8, and that sort of thing. But the real little ones got very sick. So, but now they're saying don't vaccinate them. You have to use what's the word I'm looking for? You have to discuss it with your physician.
Right.
There's a term for it. It's not in my head right now. But
The physician's discussion.
yeah, physician's discussion. No, there's another term, but that's all right.
Okay.
But you have to do that, and all that does is slow down your ability to get it in a pharmacy, and slow down
Right.
this, and slow down that, and it's just a way of trying to get
Sure.
people not to get vaccinated.
Right.
That's all.
It's very interesting because I said it earlier about superflu.
Yeah.
Okay.
Superflu. Yeah.
And as we get older, I don't know if it impacts us more, but I know that, I don't know, a month ago I got sick, okay? Not so sick that I couldn't do my normal stuff, but there was a lot of mucus and a lot of coughing, and I still got a little bit of it left. And I've been talking to people, and they say, "Oh, I had that."
Yeah.
And
I had a
somebody
friend-
else just yesterday, "I had that. I'm having it now. I'm just getting over."
Yeah.
That's an infectious disease.
Yeah, it's definitely. I don't know what it is. I've had several people tell me about it. A good friend of mine had it for a while. And he had all the virus tests, flu, COVID, RSV are the common ones that go around. But there's a lot of other viruses out there that sometimes can make you do this. Parainfluenza virus can make you do this. And that's the most common one I can think of. Adenovirus. I mean, there are a bunch of viruses that'll make you sick without making you too sick, just feel lousy. Yeah.
Correct.
So it's one of those, and
they
I don't know
mutate.
which one.
They mutate.
They
right?
mutate. Well, I don't. Yeah, those not as much as flu and COVID.
Right.
They just have a way of just changing all the time.
And what causes that?
The mutation.
Yeah.
Well, to me, it's an evolutionary involvement of what they do in order to replicate and keep moving. They know animals or human immune systems they don't know this, but
Right.
it's survival. It's survival of the fittest. It's
Evolutionary adaptation.
Oh God, I can't believe I'm forgetting this term. It's evolutionary adaptation. That they
Right.
adapt. No, it's mutate. What they do is they mutate, and what
Right.
that does is it makes the immune system less likely to do it, and they mutate more. So the idea of mutating is sort of built into their genome now. After thousands and millions of years, that's what they
Right.
do. That's how they do it. These diseases have been around forever. And they've been affecting human population for years and years and years. That's
Yeah.
the one bad thing about when we got a lot of people. And when you lived out in the country and you're hunting buffalo and there was only 5 of you in 20 square miles.
Yeah, that's when I
didn't
lived
get
in
sick.
that atmosphere, I was fine.
Yeah, that's right.
As soon
It's
as
amazing.
I moved back into the city.
It was terrible, right.
Yeah, I can't believe it. I said, "What do you mean you're not going out to hunt buffalo?" And they said, "I'm going to the supermarket. I'm going to the Whole Foods across
That's
the
it.
street.
That's it.
They have their
Exactly.
own stuff."
Exactly
Yeah.
right. That's
Yeah.
exactly right.
And then you get sick by walking in the aisle of the supermarket.
Right,
Somebody
exactly. So
sneezes
I
on
mean,
you.
it's an evolutionary mechanism. It's what Darwin did. He what his big thing was. I mean, the idea of some sort of evolution was around for a long time. What he did was the way evolution works is he didn't know about mutations, but he knew that when something changed, their body adapted to it. Common descent, I guess it's called. They adapted, and that's how evolution works. Your body has mutations. We're all very similar in our DNA, but there are a lot of mutations here, there, and everywhere all the time. And certainly in your reproductive organs, they mutate a lot because that's how they do. They mix up the genes, and things get crazy. And if your environment changes, and you don't have a gene that accepts that environment, then you may very well go extinct. And animals go extinct just for that reason.
Neanderthals,
yep.
And they there is a belief that they intermarried.
Yeah, but we all have a little Neanderthal gene, I've been told. I'm 99% Ashkenazi Jew. I don't think my family intermarried.
You never know. You got to talk to the Rebbe. He said, I remember this guy. He was a little strange.
He was a strange dude.
Yeah. So, it's interesting because that was my major, physical anthropology.
Yeah, physical anthropology.
And, adaptation, genetics, and evolution.
Right.
And in all my studies, and I still love to read about that, you can see the evolutionary changes in humanity.
Yeah.
And we all look different. We say he's white, she's black, they're Hispanic, they're Asian. It's all adaptation to climate. That's it.
That's with climate climate. Basically climate and what it is.
That's why this group has more adipose tissue.
Descent with modification. That's the word I was looking for. Descent with modification.
That's exactly it.
Right.
You're way up north. You're lighter.
Right.
You're down south. You get darker.
There really is no biological thing as race. Period.
There is.
End the conversation.
It's a construct.
Right.
It's a mental construct.
It's a socio-political construct.
Exactly.
Yeah.
It doesn't exist, and I've said that for many, many years.
Yeah.
And people will say in the comments, okay, what do you mean? It's this and that. No, it's not.
There is no such thing as
reasons
race.
for why your hair is that way and her hair is that way.
Right.
Your skin color is this way and that skin color is another way.
And why?
And the adipose tissue, why you have more fat cells in your face.
Right.
And you have fewer. It's all because of climate.
Climate and how your ancestors evolved to do it. And as we get more sophisticated, we don't mutate, we don't change as much because we're controlling our environment better. So we don't see as much now that we used to.
It used to be that you would travel by foot.
Right.
And you'd go up north, let's say, and you may have started from sub-Saharan Africa.
Right.
And where you were dark-skinned. And over the generations of thousands of years, you migrated up to North Africa,
right,
where you weren't as dark, and then you went up to Scandinavia,
where it was dark all the time.
Right. So you have lighter skin.
That's right. Because UV light helps you. You make vitamin D with UV light.
Right.
And if you're light skinned, it breaks it down. And so if you're dark skinned, you don't get that. Oh, no, I'm sorry. I apologize. Sunlight will help you make vitamin D, but when you're light skinned, the UV lights will also break down the vitamin D in your blood. And if you go north and live in that environment, when you have babies, they get rickets, they get vitamin D deficiencies, and they didn't know how to give people vitamin D back in those days. And so over thousands of years, just like you said, and a lot of people don't like the idea that human race started in Africa. That upsets people.
That upsets a lot of people. But it actually started in Olduvai Gorge.
That's right.
And the one that we call Lucy, we say Lucy in disguise with diamonds.
Yeah.
And actually, the people who discovered our Leakey family, LSG.
Oh no, Lucy was.
Lucy was an African. Right, in Olduvai Gorge.
Right.
And they named her Lucy
because they were listening.
Because of the Beatles. Lucy in the Sky with diamonds.
They were listening to it when they were working on this thing. Yeah.
So you may not know that yet.
Donald Johansson.
Well, he was
his group. Discovered Lucy per se.
Yeah, but in Olduvai Gorge
and the Leakeys were all there too. Yeah.
So
absolutely.
It's always interesting to me, which means that infectious diseases mitigated as you immigrated.
Yeah.
Okay.
Oh, yeah.
So, but now we have airplanes and trains.
It's
And
easy.
we can live anywhere.
Yeah.
We can be
And
dark-skinned
we
and
can
live
move
in the
our
north, and
diseases
light-skinned and
anywhere,
live
too.
Yeah,
Absolutely.
So,
And that's what one of the problems in the United States is. If you don't have good vaccination, then somebody coming in, like in California, I forget what year it was, the Disneyland outbreak of measles.
Right.
It was people who were from another country. They weren't vaccinated. They got measles, and it's so contagious that they gave it to a whole bunch of people.
Yeah.
And who then gave it to a whole bunch of people.
And then you pick your skin, right? And am I right with measles or that? No.
Chickenpox.
Chickenpox. That's it.
Yeah.
Is that
That's very contagious too. Yeah, very, very contagious.
airborne?
No, it's mostly with measles. It's with chickenpox. Well, chickenpox, yeah, it can be airborne. Yes, I apologize. It can be airborne, and it's also in the lesions.
Yeah.
When you're systemically ill with it, you can spread it that way too. That's what makes it so contagious. Remember, they used to have chickenpox parties.
That's right.
You would go. Somebody got chickenpox in the neighborhood. You had all the little kids go over so they could get it, so they wouldn't get it when they're teenagers and young adults, which they got really sick.
Right. And what happened was
pneumonia.
it would leave marks on your skin.
Yeah. Well, chickenpox didn't. Smallpox did. Smallpox would really mess your skin up.
But if you scratched the
Maybe,
lesion,
yeah. I'm sure if you scratch it a lot, you could get some marks. But
Smallpox. Does anybody get smallpox anymore?
no, it's theoretically eradicated, but I'm sure in some laboratory somewhere there's some vials of smallpox, and if it ever gets out, and nobody's vaccinated right now, it could be
They better check
it
that
killed
Wuhan
thousands
lab.
and thousands of people.
Murder.
Vaccinations helped win the Revolutionary War, right?
Well,
Washington didn't he?
They
cowpox,
did that, but it
smallpox?
turns out the smallpox didn't last as long as you'd think, and so by the
Yeah.
time the Indians got the blanket, that wasn't the problem.
No, I thought Washington had his soldiers vaccinated.
Oh that
Yeah.
may be true too. I know John Adams took 2 days to take his kids to Boston to get vaccinated.
Really?
You know the story of that vaccine?
No,
Edward
I talked
Jenner?
to John. I talked to John recently.
He was a little after my time, before my time, but
I was watching a show about him actually recently with Washington and Adams. But anyway, go ahead.
Edward Jenner was, I think he was a physician back in the day when physicians really couldn't do much.
Right.
But he noticed, and smallpox was a horrible disease. It wiped out millions of people. The Mongols threw it over, threw bodies over with smallpox into the cities, over the walls, and everybody got smallpox.
Yeah, and then they burned them.
Right. And Edward Jenner noticed that milkmaids,
right,
who were milking, there is something called cowpox. And they would get cowpox, which is a few lesions on your palms and stuff, but they never got smallpox. Wow. So what he did was he took some of the lesions from them and he put it in people, and lo and behold, it worked. That they didn't get smallpox. It's not perfect. Some people got sick.
But they grew horns, and they were out eating grass.
Well, I'll take another. You heard about the cow flu, right? The H5N5, that H5N1.
Is that the mad cow disease?
It's more than that. It was utterly ridiculous. The virus lived in their udders.
Really?
And so, it's utterly ridiculous. But
I got it. Yeah.
And killed a lot of cats, and dogs got it, and so far a couple of people got it, but they didn't get very sick.
But from drinking the milk?
Yeah, cats got it from drinking the milk, and cats don't do well with influenza. And a lot of cats died.
Wow.
And other animals have died. A lot of wild animals have died from bird flu H5N1 too. It's been all over the world because birds fly all over the world. They migrate. Right. And they brought it to all kinds of animals.
Well, but how did they bring it to them?
They fly. I mean, they get sick, and then they get bird flu, and they land in a chicken coop or something.
Somebody eats it?
And then they just breathe on the chickens, and the chickens get it. Wow. It's not a fun thing. I just finished a book. I can't think of the name of it right off the top of my head. I can tell you later, but about migration as part of human existence, which is interesting in the current world we live in.
Well, and it goes back to human evolution.
Human evolution and how it moved, and so much of it was driven by disease and other things like that. It's fascinating. Yeah. Just fascinating.
All that stuff. Yeah. This is real education. Alex,
that's why I like infectious diseases. Almost as much as science fiction, but not quite.
I'll tell you one death caused by vaccinations. It's kind of wild. It's Osama bin Laden. So he was hiding in this compound in Pakistan with these high walls. He was like living at someone's mansion. Like locals kind of knew there was this shadowy figure, the tall walking man or whatever. We had some surveillance eyes on him. Maybe it was him. And then when they suspected, when they were getting closer, they enacted a neighborhood vaccine program, and he was living with his wives and his kids. So they surreptitiously got a blood sample from one of the kids from a neighborhood vaccine program, confirmed it was Bin Laden.
That's fascinating.
Yeah.
Really? So
Yeah.
they took his DNA.
Yeah.
Yeah, I never heard that.
Wow.
That's
I know,
amazing
right?
too. All the stuff
So
with DNA
there's one death from a vaccine program.
Yeah, that's
Yeah.
amazing.
But not the person who got the vaccine.
Right.
Right.
Yeah.
Yeah.
That's so interesting.
So, I mean, I think a lot of the problem that we're having with vaccines goes back to COVID. You know, there was a lot of problem. But let me tell you that while I think they did it the wrong way, I agree they should have brought in schools and businesses and talked about what was going on. They did it from a bit of a high chair, you know,
Right.
do it our way, and that upset all libertarians in this country and
Right.
everything else. But we had no clue what was going on with COVID when it first came out. Nobody did. What's his name? Fauci didn't.
Fauci.
I didn't. I remember lecturing people and saying, "Oh no, 6 feet away, it's okay. It's droplet. They go to the ground if you're 6 feet away." And then it became very obvious that people who were asymptomatic were spreading it in some way, even without coughing, which meant it was airborne. And it took a long time before the medical establishment, especially WHO,
Yeah.
to accept the fact, World Health Organization, to accept the fact that this was indeed airborne. And I was taught 6 feet, respiratory viruses, 6 feet, droplet, don't worry about it, it's all cool. And it turns out that two ladies who are environmental engineers they hired a young woman who is a forensic researcher, and she couldn't do her regular research because of COVID, and asked her to go back and look at what was going on back then and why we didn't know about airborne disease. And as you know, back before the germ theory, everything was airborne. Miasma, bad air. You lived in East London, and the air was bad, and that's why you got sick, because you were
went
poor.
to Arizona because it was drier air.
TB, right? Exactly.
Yeah.
So, but they didn't know that kind of stuff, and it turns out there was a guy named William, I forget his first name. Harold William. All right, doesn't matter. Dr.
His last
Wells.
name was Wells.
Wells.
What a great
Wells.
name for a doctor.
Yeah.
How are you? I'm well.
Well, he was an engineer. He trained at Harvard, but he was an irascible son of a gun, and he pissed everybody off all the time. But he's the one who determined that TB could be transmitted through the air. He actually took air from a TB ward and put a bunch of guinea pigs. Some people say it was something else, but I read guinea pigs. And a lot of them died of tuberculosis.
Wow.
And then he took a UV light and put it there, and they stopped dying of tuberculosis. So clearly what was coming out of that ward was in the air.
Right.
And he tried to get that data published, and people gave him a hard time. He was a terrible writer, too, just an awful writer. And he actually was in the city. He was at Penn for a while. And he actually, for measles, he was doing the same thing. He put whatever they used for UV lights back in the 30s, which weren't very good, I guess. He put it in some of the private schools in Philadelphia and not in another one. And more kids got it in the one that didn't have the UV lights and did. Now, it wasn't perfect because you get it outside, too. They don't spend their whole lives in there.
Sure.
But it clearly made some kind of a difference. But he really had a hard time convincing people that this was airborne.
And he went to Penn.
He didn't go to Penn. He was doing research at Penn for a while.
You know, I may have mentioned this before, but when I applied to Penn, they wanted me to go to their remedial school.
I almost
It's called pencil. So I figured, forget
Yeah,
it.
forget about
Okay,
it. Well, I'll tell you the story my father told me too, but remind me to tell you my father's story. But anyway, so, and he went to the CDC, whatever they called the CDC back then, and said there's diseases that are airborne. And whoever was their epidemiologist at the time said, no, we're not going back to the 19th century. We're modern doctors. We wash our hands and we're very careful. And this is crazy. But he published his work in about 55. And it's and I looked at the chart and it's wrong. But what he said was that particles larger than 5 microns 100 microns, I should say, can float in the air. And a lot has to do with the physics of a little bit of fluid, it evaporates and all that stuff. And
the molecules in the air itself.
Right.
It's a kind of air.
But what but to get to, for TB, they had to be very small because the TB germ has to get all the way down into your lungs to cause a problem. And that's what the CDC in the early 60s said, okay, anything greater than 5 microns, 5 millionths of a meter, is a droplet and falls to the ground. You have to be really, really small, and that was wrong. That was totally wrong. And I was taught that. Fauci was taught that. All of us were taught that because they made a mistake in the early 60s looking at this guy's work, which wasn't that easy to read.
Wow.
And this one woman and the 2 environmental engineers, they went and found this out and realized that we were all been taught the wrong thing for 30 years. And so we didn't know it was airborne. I remember lecturing some people saying, no, you don't have to wear that special mask. You can just wear a surgical mask because it's droplet. It'll fall to the ground. And I was wrong, and I learned. And Fauci, also, there weren't enough of those N95 masks, the one we were wearing toward the end, to go around at that time. And so he thought he was doing the right thing, and they want to crucify him. But that's another story for another day.
Well, it's interesting because people didn't realize, people thought that the droplet would fall to the ground.
Right.
But it was not true, so it wound up that the people fell to the ground.
That's right. That's right.
It's like
he has a way of distilling things down to their essence. I can see that.
It's like Rosie Posey, right?
What's that?
Rosie Posey, the children's nursery rhyme, isn't it about the plague?
We all fall down.
We all fall down.
Well, that was from the plague, right? That was the plague.
Mm-hmm. Yeah. So that was the plague, the Black Plague.
Yeah, the bubonic plague.
The bubonic plague.
Yeah.
Wow.
Absolutely.
Of course.
Fortunately, we have antibiotics now, but.
and it's funny because antibiotics, like penicillin.
Right.
Okay. As a little kid, I was allergic to that.
Right.
Okay. Antibiotics. There are some antibiotics that will just have a real tough thing on your gut.
Oh yeah, sure. Erythromycin and stuff like that. Yeah.
There's another one that starts with a C. Why is it escaping me? But I remember taking it for dental.
Clindamycin?
Clindamycin.
Yeah.
And I've never recovered from clindamycin. I took it. I called the doctor. I said, I cannot continue to take this.
Did you have diarrhea? Get bad diarrhea? If I may ask a personal question.
Yeah, diarrhea. It was years ago, and I don't have the diarrhea anymore. I have a diorama, which is
Thanks God.
in my
with
the pictures and everything. Yes, I had everything like that.
Yeah,
and it was just a week.
Right.
Okay, less than a week, and it was clindamycin.
Yeah, and some people react differently.
Horrible.
Yeah.
Horrible. So I take antibiotics. I always take them close to in my bathroom just in case. Okay, but yes, clindamycin. How did you know that? You must have ESPN.
It begins with a C. It does. The one that I'm trying to. It couldn't be chloramphenicol. That was another drug from another era.
No,
so it had to be clindamycin.
Yeah. And why is that?
Well, I mean, some drugs just irritate your stomach. In fact, some of the gastroenterologists use a form of tetracycline. The chlorotetracycline, one of the forms of tetracycline, if somebody has a bowel ileus and things aren't moving, and they give them that and it makes the bowels move. Yeah.
Really?
It's not, it's like using leeches, but it's.
But isn't it?
But they can do that.
So if they constipate the person.
Yeah, they sort of keep things moving. When you have surgery or you're real sick, your belly swells up and you listen for the bowel sounds and there's nothing there, and you get an X-ray and it's full of air. They call that an ileus.
Really?
And they sometimes use that to help get the bowel moving.
Wow, an ileus.
Yeah, I mean,
not to be confused with an alias.
No, or an alien for that matter.
Or an alien. But it is interesting because now I take a probiotic. I've been taking a probiotic for years and years.
Right.
Okay. I wanted to take an amateur biotic before I took the probiotic, but they didn't have them.
They didn't have it.
That's what I.
And they didn't cost anything. They were free, the amateur ones. Not anymore. Now they get paid.
Now they get paid. Now are they really amateurs?
That's right.
But it's very interesting to me because
And sometimes that
that's what-
happens. And that's another reason not to take antibiotics if you don't need it. Most infections that we deal with are viral.
Right.
And as I said, if you take an antibiotic for a viral infection, antibiotics aren't work on viral. Then if you'll get better in a week, and if you don't take it, it'll take 7 days. So I mean, they don't help you. Is what I'm trying to say.
We started off with that.
Yes, we did.
It's amazing to me how things just go around,
Yeah.
right, Alex? I mean, it's just we started off with that.
And
Like an
now we're back.
infectious disease. It
Yeah,
just
like an
goes
infectious disease. That's
Like-
right. Yeah. So,
Are you okay?
No, I'm fine. I have no
That guy's cool.
I have no
I got to
time.
stand up now. See, it says on my watch.
That's it.
Okay, I'm going to do this so everybody can see that on my watch. And I used to get scolded for this. You're cheating, and I'd say, wait a minute now. When you move your arm like this, you're not cheating. It's
You're winding your watch.
Yes. Plus, it takes calories to do that.
Well, they say people who bop with their legs don't gain weight, which I've done all my life, and I don't gain weight.
That's
So
right.
You can't do it. It's just part of your personality.
Yeah. You mean this, right?
Yeah.
You mean
with the
this.
leg, the leg
leg.
moving all the time. Yeah.
Leg
I'm doing
moving.
it now.
You are?
Yes.
No wonder you're so slim. I have students that do that, and
Drives
10
people
years
crazy.
later,
Drives
10 years
people
later,
crazy.
they're still the same weight.
Yeah.
you know.
Drives people crazy.
But you know what? I'm going to start doing it. I ride a bike I work out every morning, but yeah, it's good. So bop your leg. I didn't know that's a medical term.
Well, yeah, it's medical. It's actually Yiddish, but no, I'm kidding. I don't know what it is.
It's a medical.
It's a medical term.
So, what do you see happening with infectious diseases moving forward in the future? What do you?
Well, let me get back to vaccines with that.
Okay.
If our Secretary of Health and Human Services stays in power and continues to do what he's doing, we will start seeing more and more infections and sickness in children because we're not giving vaccines anymore. And so that's one thing I'm very concerned about. I don't want to go back to the past. Vaccines were probably one of the greatest accomplishments of modern medicine. To prevent disease before you get sick. They were, I mean, unbelievable. There's even others. There was a childhood meningitis, Haemophilus meningitis.
I remember that.
And that vaccine's gone. Doesn't happen to kids. And if they survive, they were deaf, and it's gone. We don't see it anymore.
What do you mean? The disease is gone?
The disease is gone because every kid is getting the meningitis vaccine. Now, I didn't even see that in the list. I guess it's still there. I'll have to go back and look. But
So when do they get it?
when they're in,
they're born?
after most people don't get vaccinated till like a year to 18 months because before that you've got a lot of your mother's antibodies and the vaccines don't work as well. But like for measles, if you travel, like you get it at 6 months and then you get it again at a year, so you don't get it as an infant because you can really die quickly if you're
measles?
an infant and you get measles. Yeah.
Wow.
So before we, I don't know how long we have to go, but I want to finish up and tell people that please do not believe what you're hearing from the government, from the Health and Human Services. It is 100% wrong. I have no connection with Big Pharma. I don't make, I don't, get any money from any of those people. I'm an infectious disease doctor, which is one of the lowest paid doctors in the universe. I'm
Should
all
be the
right.
highest paid, I mean,
You're preaching to the choir.
Right.
But I'm telling you, don't turn your back on vaccines. It is a huge mistake. Your kids are going to be fine. They're not going to get all these diseases. And if they don't get the vaccines, we're going to have South Carolina, we're going to have Texas, we're going to have some of the other states in the United States where this has been going on, and it's going to be horrible. The other thing that I worry about is overuse of antibiotics.
Yeah.
And the resistance, we're already starting to see an increased resistance in everyday infections. Now, we have medicines to treat them with. But if you'd asked me 10 years ago, we didn't see these. And now we're starting to see these antibiotics are more resistant to most of the penicillins and cephalosporins. And we have to go to another set of drugs up the food chain a little bit. And if we use too many of them, then we're going to get resistance to them. And we already see that. But the good news is most people who get that are already very sick. They're in the ICU. Their immune system's not, and so we're not seeing it in everyday life. But we're seeing a lot of these what they call ESBL, extended spectrum beta lactamases. I won't bore you with the details, but the fact is the common penicillins and cephalosporins that we use all the time, and which are the best drugs, we can't use anymore. And that's become a huge problem. It's not rampant, but it's now much more common than it was 10 years ago. So they're the two things that really worry me about going forward in medicine, and that's why I do this antibiotic stewardship stuff, to try to get people to pull back a little bit.
Right.
And don't use as many antibiotics for viruses and other things like that. And if you're going to use them shorter time. You remember the old adage, you should take all your medicines and don't quit because it'll get resistance. Well, it turns out that's wrong. If you take them for too long, then the bugs who are left over get resistant to it. So there really is a movement in medicine right now in infectious diseases that shorter is better.
Wow.
You don't need as much antibiotic. You get rid of it fairly quickly. The old days when we used penicillin for things, back in the 50s when they didn't have a lot of penicillin, patient had no fever for 2 days. They stopped because they just didn't have that much.
Yeah.
But then this idea came along that we had to take it for, strep throat, theoretically you should take it for 10 days because it might have prevented rheumatic fever. It probably did prevent rheumatic fever back in the day.
Right.
And so that was 10 days. And so from that, it became a week, it became 2 weeks. And you know why? We'd say, you take it for 7 days, you take it for 14 days? Because it's a week. It was easy. There is very little data, and this is the God's honest truth, about how long to take antibiotics for any infection.
Really?
So the real smart guys are trying to push us to use it shorter and shorter, and it's working.
So shorter is better.
Shorter is better.
That's what I told that young lady years ago. When she was looking for a guy who was 6'2", and I said, shorter is better.
I'm with you, man.
You know what I mean?
I'm shorter than you. And
It's true. I mean, I was on the basketball team, but only as the guy who brought the basketballs out on the floor. So
let me tell you my dad's story.
Yeah.
So I went to Penn undergrad. And I got in because my mother went to Penn. I can tell you that. I was a good student, but I don't know if I got all A's in everything. And I got to Penn, and in Penn, I got my hair, let my hair grow long, and had a mustache and the whole 9 yards. Right? We all did that. I mean, that was what it was like back then.
Yes.
And I went to my interviews for Penn Medical with the long hair and everything else, and I applied to the medical schools in the city and some others too. And I got into Temple early admission. I was very happy. I was thrilled and delighted. That's all I ever wanted to be in my life, was a physician. Wow. Nobody pushed me. My dad didn't push me. I just wanted to be a doctor.
So you got into Temple Med. And
I got into Temple Med early. In February, I got into Penn. And I went to my father, who was a bright young pediatrician at the time, and I said, Dad, I got into Penn. I'm going to go to Penn Medicine. He said, no, you're not. You're going to Temple. I said, what are you talking about, Dad? I want to go to Penn. He said, Ronnie, in those days, Penn was $5,000. Now it's $50,000. But in those days, Penn was $5,000. Temple was under $1,000 because it was a state-supported school.
Right.
And he looked at me and he said, do you think anybody's going to give a beep where you went to medical school in 20 years?
That's it.
And he was right.
That's
he
it.
Was absolutely. I got a great education at Temple. I know.
Down there.
I know. It's a great medical school.
It is a great medical school. It's a great university.
Yeah,
it is.
It is.
We are blessed to have Temple and the other universities here.
Yeah.
We have some. Philadelphia is really a medical hub.
Right. No, absolutely.
Absolutely. It's great. Well, I'm glad you went to Temple.
Yeah, no, I had a great education. I never look back. It was he was right,
Yeah, Temple Med.
Yeah.
You're a doctor. They still call you doctor.
Yeah.
You know what I mean?
Right. It's right. Yeah.
What did I used to say to people? When was the last time you went to a lawyer and you see the lawyer? Because we had Saul on. He's a lawyer. You're a doctor. And Guinea's a lawyer. And said, where did you graduate in your class? Does anybody ever ask that?
No. Nobody.
Of course not. So you could.
No, I see what you're saying.
Call you a lawyer.
Yeah.
But you could have been the last one in your class, but you're still a lawyer.
Yeah.
It's the same with a doctor.
Yeah, so you're a doctor.
You're a doctor.
If you get a good education, I had a wonderul education at Temple, and I had
Temple's as good as any of them.
I had a great. I'm very happy in my career. I sleep well at night.
Yeah. And you don't take any drugs to do that?
Well, no. I won't say it. let's not go there. How about that? But I don't take drugs to sleep. Let's put it that way. No,
Yeah.
I'm kidding. I don't take any drugs.
Yeah,
anymore. The 70s was a different time.
70s was different.
Different time.
You could relax in different
We
ways.
thought we were changing the world. Little did we know.
Now we just have to change our clothes.
Yeah, that's right.
Sometimes a little.
The underwear,
if you take the clindamycin,
Yeah,
you
that's
got to
right.
change your
You
clothes
have to
every
change
day,
it, right.
every minute.
Every minute,
Not every
yeah.
day. Change it every day.
Well, there is a
anyway.
disease caused by clindamycin. That clindamycin starts. It's not caused by it. It's called Clostridium difficile. Have you ever heard of that?
No, but I
C.
probably.
diff.
Oh yeah.
You may have had that.
Yeah.
You may have had.
Yeah,
C. diff.
that's what they told me.
Yeah,
When
you
I
had
went
C.
back to the
right.
doctor, I
And
said, I
it's-
can't do this. They said, you got C. diff.
Yeah. They used to call it clindamycin-associated colitis back in the day. That was the first name before they realized what the organism was, because they saw so much of it. And they used clindamycin to study it in guinea pigs or hamsters or something like that, so to learn more about the disease.
You know what you need? You need a fecal culture transplant.
Yeah, no,
Yeah.
that's right.
Yeah.
What is it?
FMT, fecal microbiologic
You need
transplant.
someone to share their shit with you.
Yeah,
Really?
And one of my associates was actually doing it for a while. Now they have pills and other things that you can do, but he had a couple of sources where he would get poop from, and he made sure they had all the right. They didn't have HIV and hepatitis and all
Right.
that stuff. And he would mix it up. He'd go to micro lab, put on double thing, and run it through. What do you call it? Not sackcloth, cheesecloth.
Cheesecloth, yeah.
Run it through cheesecloth 2 or 3, 4 times. And he would come up with this, kind of not brownish. It was kind of not quite clear fluid. It was clear, but it had a little brownish tint to it. And he would put when somebody had recurrent C. diff, it would come back a lot because once your microbiome is screwed up, you have no way to protect yourself. And so what they would do then is take a little and put it down the tube. And, some people got a little sick and everything, but most people, and it really does work. And now they have pills that you can use and other things like that.
Really? To do away with C. diff?
Yeah.
Yeah, I really believe that's what happened to me.
Yeah, I'm sure it did. I'm sure it was.
Yeah,
I'm
and
sure it
because
was.
I had other, I took it because of a dentist,
Right.
procedure. And the other time they said, you probably got C. diff.
Dentists are great. I have a great dentist. Just don't know anything about antibiotics. It's just that surgeons and dentists, they don't know anything about it.
Or doctors like me.
Yeah, nobody does. That's the problem.
Yeah.
I'm a little bit of an antibiotic snob, I'll tell you that right
You
now.
are, and I like that. We need antibiotic snobs. As a matter of fact, Ron, this has been great.
Right, thank you.
I really appreciate it. I learned a lot. You educated me.
Yeah, I try.
And the audience, the group out there.
Yeah, thank you.
You know,
and I just
and
want to
Alex.
say again, trust vaccines. They're the right way to go. They're safe. They're effective. Do not listen to the BS that's coming out of Health and Human Services now in the last year. Please.
Perfect.
Take care of your kids. Take care of your grandkids. Let them get vaccinated.
And your great-grandkids.
And your great-grandkids.
Ronnie,
My pleasure.
thank you, sir.
Yeah,
Thank
my
you.
pleasure.
Folks, remember, don't forget to subscribe, like, and follow. Go to dangoldberg.com, click on our page, click on YouTube, Spotify, TikTok, Instagram, and like us, follow us. I want to thank Ron Goren,
My pleasure.
infectious disease doctor. I hope you learned a lot today from it. And remember this. I wish I could remember it. Use your mind. If you don't, others will. We'll see you next time on Digging for Gold.